Hi, welcome back to the Denali Medicare channel. If you're on Medicare or about to be, you've probably been hearing about the One Big Beautiful Bill Act that President Trump signed into law on July 4th. There's been a lot of misinformation about what it changes for Medicare and health savings accounts. So in this video, I'm going to walk you through what those changes are. I'll start with the Medicare changes that impact you the most, and then I'll talk about what didn't change, which is just as important. So we'll cover the Medicare changes that could affect your coverage, a temporary payment increase for your doctors, what the new rules for direct primary care mean for you, and the HSA changes that made it into law. And last, we will talk about the provisions that you heard about that didn't become law. So knowing all of these facts will help you to avoid different planning mistakes that could be made based on inaccurate information. Let's start with the most significant change for people who are currently on Medicare or are about to enroll. The law tightened Medicare eligibility requirements, especially for non-citizens. So here's what changed. Starting immediately, Medicare eligibility is limited to specific categories of non-citizens, lawful permanent residents or green card holders, certain Cuban and Haitian nationals, and individuals from Pacific Island nations with special agreements. The law removes eligibility for many people who were previously covered. This includes refugees, asylum seekers, survivors of domestic violence, and individuals with temporary protected status, even if they've worked and paid Medicare taxes for years. Now, if you're already on Medicare but you're affected by this change, know that you can keep your coverage for up to 18 months from July 4th before it ends. The law includes a temporary 2.5% increase to Medicare physician payments for 2026. So basically, this gives doctors a small increase in Medicare reimbursements, and this could actually help to maintain or improve access to care. Okay, next, let's talk about the HSA changes that became law. So there are two main updates. First, Bronze and Catastrophic Affordable Care Act plans now qualify for HSAs. Starting January 1st, 2026, if you buy a Bronze or Catastrophic plan through the ACA marketplace, you can open and contribute to an HSA, even if the plan doesn't meet the traditional high deductible health plan requirements. Now, in the past, to qualify for an HSA, your plan had to meet strict minimum deductible thresholds, but under the new law, those deductible rules have been relaxed for Bronze and Catastrophic plans that are purchased through the exchange. Second, direct primary care fees can now be paid with the HSA funds. So let's talk about direct primary care, or DPC. Direct primary care actually allows people to pay a doctor a flat monthly fee, like a membership, for unlimited primary care visits in that month. Starting January 1st, 2026, two things are going to change. First, you can use your HSA to pay for your direct primary care fees, and they can cover up to $150 a month for individuals or $300 a month for families. Second, direct primary care agreements no longer disqualify you from contributing to an HSA. Before, paying for a DPC membership was considered a second health plan, and under IRS rules, that meant that you were ineligible to contribute to an HSA. But DPC is growing in popularity, and this change acknowledges that a lot of people want to be able to have both personalized care that they can get from a DPC relationship and to be able to have the tax advantages that they can get from an HSA. This part may be important to you if you live in a rural area. The law creates a $50 billion rural health transformation program to help rural hospitals stay open and improve care. Does anyone else have a hard time saying the word rural? Or is it just me? Anyway, states have to apply by December 31st of 2025, and the funds will get distributed over the course of 5 years. And they can be used for infrastructure, for equipment, and for recruiting new physicians. You might be wondering, why in the world am I telling you this? Well, this matters for you if you live in a rural area because many rural hospitals have closed in recent years. And if your local hospital is at risk, then this program could actually help to keep it running. Now that we've covered those changes, let's clarify some confusion around this bill. Some provisions were widely discussed and proposed, but they didn't make it into the final law. These are the things that did not become law. Medicare Part A beneficiaries still cannot contribute to HSAs. HSA funds cannot be used for gym memberships or fitness classes. And couples over 55 still have to open separate HSAs if they want to make catch-up contributions. These things were included in earlier versions of the bill, but they were removed during Senate negotiations. So here's the bottom line. The One Big Beautiful Bill Act made some meaningful changes to Medicare and HSAs, but probably not as many as you might have heard about or had been expecting. The biggest impacts are likely the Medicare eligibility restrictions and the expanded flexibility around HSAs and direct primary care. More importantly, remember not to make any planning decisions based on rumors or early drafts of a bill. The final version of the law is different, and that matters. It will affect you. At Denali Benefits, we stay informed so that you don't have to. We're available to help you review your situation, and we understand how these changes are going to apply to you. So if this was helpful, please like and subscribe for more clear explanations of how healthcare policy is going to affect your budget. Thanks for watching, and I will see you next time.